All right, folks. Woohoo! Welcome to Recovery Live in February 2022. C4 Innovations is thrilled to bring you another Recovery Live event. And if you've attended them previously, you know that we try to bring top tier speakers and really interesting and challenging issues and some strategies that help both peers and non-peers alike in improving the lives of other folks. Next slide, please, folks. And we at C4 Innovations, or C4 for short, we're committed to advancing recovery, wellness, and housing stability for people who are marginalized. And we're committed to reducing disparities and achieving equitable outcomes. We engage, support, and partner with service organizations, with communities, and with systems to develop and implement research-based, evidence-based solutions that are person-centered, recovery-oriented, and trauma-informed. And you can learn more about the work C4 does by visiting our website at c4innovates.com. And don't forget to follow us on Twitter, Facebook, LinkedIn, and YouTube if you're so inclined. Next slide, please. Today's Recovery Live event is like all of those in the past. It's interactive. You're going to engage directly with our presenters and each other through the live chat box. We're going to have the speakers share some of their initial thoughts, and then we're going to answer some questions that come from all of you that you're going to raise during this event. All the audience members are in listen-only mode, but as I've seen you all doing already, you can introduce yourselves, you can pose questions, use that chat to share ideas, resource links. If you've got some technical difficulties and you can still access the chat, let us know. We'll be happy to try and get you through that. If you want to send a private message to the hosts, please be sure you use the drop-down arrow, select all panelists in order to get your message directly to them. But we really want you to participate in the chat to the extent that you feel comfortable. So if you want to do that, just make sure that you select hosts and attendees, and that's what it defaults to anyway. And then your message is going to end up going out to all of us. And you just click the word chat on your screen, that chat box is going to pop out. And if you want to, you can resize it, drag it around, and move it out of your way. Next slide. So we're going to spend about an hour today. This is going to be recorded, and then the recording link gets shared with everybody who registered after we're done. It's also going to be available on the C4 YouTube channel, and that's on the slide. And if, as you're listening to this, and you feel like your organization might benefit or need some technical assistance around this topic or any other, just email us at training@c4innovates.com. And we're happy to just talk through your needs. We'll brainstorm some strategies, some potential solutions. We'll work together to really figure out the best technical assistance we can get, and whether or not what you're talking about is even technical assistance, because sometimes that's really confusing. All right, next slide. So I want to get us all back to why we're here today. And what we have happening are our three amazing presenters. And excuse me, we're going to be talking today about homelessness and mental illness and the challenges that brings to our brothers and sisters who are still out there languishing on our streets and alleys. And, we have the folks here bring both professional and lived experience with today's topic. And this discussion should really help us understand the challenges and then some of the strategies and the efforts that are being made to really support the folks who are experiencing homelessness and struggling with their own mental illness, whether or not that's been something before they were on the streets or as a direct result of them experiencing homelessness on the street. So it's really exciting. Ashley Blum is the director of homeless outreach services for Park Center in Nashville, Tennessee. I also know Ashley personally. I worked with Ashley in the mid-2000s on a street outreach team with her. And it's amazing to see the incredible evolution that has happened over the last 15 years now. I'm also joined by Daryl McGraw, and Daryl is the Associate Director of Social Justice and Recovery here at C4 Innovations. And Daryl is also a dynamic force around supporting our brothers and sisters who are trying to re-enter from jail, prison, state hospital. If it's re-entry, you want Daryl McGraw on that task with you. It'll be a pleasure to have him today and listen to him contribute. And finally, last but definitely not least, Michael Sanchez. Michael's the Director of Peer Development at the Peer-to-Peer Recovery Resources in Denver, Colorado. Folks, we'll get started in just a second. So before we do get underway, please be sure to add any questions or comments that you might have into the chat. We're going to move into a Q&A session after we talk a little bit through the three speakers here. It'll be right around 35 minutes or so past the hour. During that Q&A, folks will try to respond to as many questions as possible. We may not be able to get to them all. We apologize for that, but we'll do our best, okay? So with that, let me turn this to Ashley first. Ashley, if you could share just one important thing, perspective, opinion, or thought about why this topic was important enough for you to come speak, what would that be?
Hey, Stephen, thanks so much. Thanks for having me. This is a hard question for me because I think that we need to know a lot of things, but I think that the most important thing from my perspective is that we meet people where they are. And I don't mean always just about like where they are mentally or emotionally, because yes, we want to do that always. But I also mean physically, where they're living, not requiring people to come into our building space, really taking care to people, I think is one of the most important ways to build trust and to build wraparound services. And so what we've done at Park Center is we have created a street medicine team. We've been doing it for several years, and it's been a really wonderful way to have us, build that trust and build that relationship with folks so that we can get them where they feel safe and comfortable to work towards their recovery. So I think that that is one of the biggest things for me and for our teams, because there's so many barriers. We know this. There's transportation, there's trust, people are experiencing psychosis, or maybe they're using substances, and whatever the case may be that limits their ability to get places. If we take the care to them, then we can really start building that foundation to help them work towards their recovery.
Ashley, fantastic. And I, as I said when we kind of started this conversation, I've watched that team and really the approach to providing homeless services really evolve, really become person-centered, trauma-informed. I love the way you framed meeting people where they're at, because most of us do go to that emotional sort of kind of fit those pieces. And we don't often think about, well, where are they physically? But that point is hugely important. And, I think anybody who's done this work recognizes that, there's competing interests for our brothers and sisters who are experiencing homelessness. If you're a provider and you're asking them to you've done a referral for a 1 p.m. appointment across town with a mental health provider, and we know that you can get lunch in the other direction, what do you think folks are going to do? I can tell you I'm going to go eat before I go see the provider, and it's no disrespect to the provider, but I have personal needs to meet. So Ashley, just thank you for getting us kicked off, and I want to turn to Michael or Daryl. Anything that either of you want to add or just comment on from what Ashley has mentioned?
I was letting you go, Mike. I thought you was going to jump in. I could wait.
Go ahead, Daryl.
Oh, okay. Ashley, nice. And Stephen, thanks for having me. Of course, C4, we You know, I love when we have these opportunities to connect with people in recovery and do these recovery lives. Ashley was right on point with meeting people where they're at. You know, as you mentioned in my intro, like the people that I mostly connect with is definitely the individuals that are justice involved, whether there's returning citizens or individuals that have a criminal record and still struggling. And many times we find ourselves homeless. We're one of the hardest populations to rent to. And when it's time for transition, you know, we are 9 times out of 10 dropped off at a courthouse or on a court green, homeless. You know, now we just served time and now we're here. So understanding, meeting people where they're at. This is why before we even start this conversation, I have to say first, Andy, that we are firmly believers, and we need to start off with reentry begins at the beginning of the sentence and not the end, right? So identifying that people are homeless when they come in. So no matter when they're getting out, we gotta make sure that they're not homeless when they return home. So I'm excited for this conversation, as well as our brothers and sisters go in with mental health challenges, come home with mental health challenges, and these mental health challenges are going unaddressed. We're gonna have a live conversation today about that. So those of you that work with this population, jump in, chime in, keep that chat box on fire. Let's go, let's get it.
Yeah. All right. Well, thank you all. Thanks for being here. Thanks for having me. It's an honor. And you know, and both what you said is very important. And, you know, and at P2P, it's nice to be in a position where we have coaches doing the work. You know, we're fortunate to be in central Denver, and there are a few food banks around where coaches will, if someone's got something going or they're coming in for a one-on-one with a clinician just to update their treatment plan, you know, we've had coaches go out and get them some food while they're doing that. On the other end, you know, we are in a position now where we've just partnered with a reentry agency to train coaches. And we are beginning to take steps to work with people inside the Department of Corrections. You know, there are programs that are being piloted to get peers trained in prison. You know, I would like, and they catch them within 6 months of release to do the peer coaching and help people prepare to get out. I would like to take it a step further and get to some lifers who have no chance of getting out, but who have been given a life sentence and almost a death sentence, because when those doors close behind them, they decide then and there to change their lives and help people as much as they can going forward. Let's get those folks trained as peers as well, so they can help young brothers and sisters navigate the prison system in a more healthy way. Have some humanity in that experience that is completely dehumanizing. Yeah, that's all I wanted to add. And, you know, that's, again, to me, it's just reintroducing that humanity and just, you know, loving on some people so that they can feel loved and love themselves.
Michael, thank you, brother. I mean it. You know, it's at the end of the day, it's like the relationship is what matters. And you know, that's just, I mean, already that, you know, somebody in the chat is like, amazing. It's, you know, and thank you so much. That came from Mary. But here's the thing, gosh darn it, it shouldn't be amazing. It should be standard, you know? And I think that, you know, that's kind of the frustration that folks have, that, you know, we have been battling this for decades, honestly. I mean, homelessness has been around here for a very long time. And I know that the new director of the Interagency Council on Homelessness in the the US IHC, I'm sorry, I'm getting the acronym messed up, but I can remember watching that person, Jeff Olivet, talking about the history of homelessness in the United States. And it goes all the way back to like Pilgrim days, which is, I mean, it's just shocking that we have been dealing with this for this long, and that we're still pretty crappy about how we're successful at it. So, you know, it requires our voices, I think. And we're seeing that when the voices of lived experience, particularly related to issues of homelessness, are heard, changes happen, and those changes matter. I mean, they have made some pretty significant differences in the lives of people. So let me turn to you, Michael, really quickly. And I'm going to ask you the same question. If you got one thing that you want to share that you think the world needs to know? What is it?
You know, it's being involved in the journey, being invested in your community with the understanding that that is an investment in yourself and the people that you love, and encouraging people to take that next step. You know, I'm in a great place in its peer development. I do my best to encourage people to push their limits as far as their education, because, you know, let's be honest, most of us in this work as peers or people with lived experience have been told that we can't, that we shouldn't, that, or that you only can, which is a bunch of BS. And sometimes I get pushback. I've been in a workforce development advisory council in the patient navigation arena for a while, and some people in leadership, well, you know, I don't know if my people, I don't know. And it's like, damn it, raise their expectations so that they can raise their own expectations. And we can get to places where we can be in these positions and influence structures and policies in a realistic way. And just, again, you know, share that love, share that relationship, share your passion for your community and the people who are like you. And we ignore one person in our society, we may as well ignore everyone, because if we lift one person, we create opportunities to lift all. You know, and that's, I know that's my passion, but I believe that's important, and that can help shape everybody's work going forward. Because if you can't be free to share love while doing something that you love, then what are you doing? You know, so yeah, that's it. And you know, and you know, and at P2P, that's something we are trying to foster and share with the people that we're trying to help, you know, get to where they want to be in life.
So Michael, I'm going to check in with Ashley and Daryl in just a second, but I wanted to just say something. Colorado, and you know, the work that peer-to-peer is doing, you know, I know your executive director fairly well now. You know, he's an amazing man that is all about the relationship and about love, right? I mean, it really is kind of that simple. And I also know a recovery coach who runs a virtual recovery coach service in the Colorado, in the state of Colorado. And one of the things that she does is, and she does a lot of homeless work, and she brings things like a lavender cachet for aromatherapy, for somebody who might be out in a tent or a camp, who hasn't had anything but the smell of a creosote burning chunk of wood or a tire, or you know, whatever it might be that, you know, is trying to keep the fire going for it. It is the most selfless and kind act to just say, you know, I can't, there's nothing else, but here is at least something that just brings a moment of, I'm, you know, I'm not homeless anymore, or I'm not thinking about that anymore. I'm just smelling my little, you know, my aromatherapy for a second. And I know that sounds crazy, but it means so much, because it is about that relationship, right? It is about love, and it's about showing people that you care. And when we do that, I think people respond to that. So Ashley, Daryl, anything to add to what Michael was sharing?
Yeah, so when Michael was sharing, thank you for that, by the way. I think something that came up for me was that it is so important to have peers, okay? To have people that have that lived experience to get out there and help human beings feel like human beings, and help people share their story, and have people sharing their story to help people feel comfortable and safe, because that's how we build that relationship. That's how we show that love and care. And so when you were talking, I mean, I don't have peer specific roles. I hire peers in my roles because peers can do anything anyone else can do. And now we have some peer specific roles in our organization because I definitely think they're valuable. But I have 9 peers and I have on my team, and I have a few more people going through the CPRS training here in Tennessee. And it's just so important to help people feel that care and that love, and so that they can feel safe to move forward in their recovery. And so I just wanted to add that it's really important. If you don't have that piece in your city, or if you don't have that piece even in your organization, it's really important to look into that because, you know, it is, yes, for the reasons I've said, but also it's really important to look into it because you may not have those, you know, you may not have those resources. And I'd be happy to like share with you how we brought that to our organization. I mean, we have a peer committee at our organization. We have, you know, peer specific positions. We have, and then we are all hiring people with lived experience, and we're like allowing people to feel comfortable and safe to share that with us, so that then we can even like honor that as experience, as like as an experience that we will give a pay increase for, because it's something that's so valuable.
Man, it's powerful, Ashley. Golly, it just, you know, says you've discovered and you understand the value that peers and that voice of lived experience bring, and how that value it really translates into organizational effectiveness. Yeah. Dee, anything to add about Michael's or Ashley's last couple of comments?
No, yeah, you know, I'm sorry, I'm moving around. I'm trying to get situated and get comfortable in here. You know, when I'm not in my space, you know how you get when you're not in your space, but you know, I'm in good company. So I really appreciate you guys holding it down. And you know, I love what Ashley said, and Michael always, brother, you know, you always bring that heat. But like, I want to just chime in further. I see some chats in the chat box. You know, we at C4 train forensic peer support because and show organizations how to implement that. But like Ashley said, if you do not have peers, people with lived experience on your boards, at your table, making those decisions, as well as working within those organizations, there's nothing like having someone you talk about meeting somebody where they're at, having an individual that can say, I've been there, I've done that. I know what it was like to be homeless. I know what it's like to sell all my stuff at the pawn shop. I know what it's like to lose your kids to DCF. Hold on, y'all know what I'm talking about. When you talk like that and you can say, listen, I've been there, but today I'm here, I'm working with this organization. My life is different. I'm a homeowner, I'm a business owner. When you can do that and you can translate that and show that this life is possible, see, because everybody talks about what looks like a fantasy. I know when I first returned home, when I first got in recovery, they talked about this world beyond life beyond your wildest dreams, and all this stuff sounds good, but you can't really see it until you see somebody that actually, that you know was there, been in the trenches, and now you see them doing something different. Or we like just listening to Ashley speak, we speak the same language, right? You understand. And like Michael talked about, that language of love, that compassion, you got to understand that. So when you're working with these organizations, and just like somebody said in the chat about how these landlords discriminate against people because of their mental health diagnosis, sometimes they don't even know what the diagnosis is. They just know you belong to that organization, right? If you're a part of that organization, you're affiliated with those people. So we don't rent to those people. So we got to make sure that we have people that speak this language and advocate for those. We advocate when we're like, no, this brother can pay his rent. He's going to do this and this, and he's in transition. She's in transition. And let me tell you, I was just like them too. Come on, man. Let's go, man. We ain't come to play no games.
You are amazing, brother. I mean it. Michael, Ashley, anything you want to add before I go to Dee to get what's on his mind about his most important priority? Because you know there's something there.
Yeah, I actually want to speak to something Daryl just said, which is just super powerful, like that stigma that is out there around people experiencing mental illness, homelessness, substance use, even into like, you know, there's racial disparities, and like there's a lot of like trans disparities too, transgender stuff. It's important that we continue talking about that, right? Because people are getting turned away for reasons that we have no clue why. And so it's really important that we as organizations advocate as hard as we can, and we educate ourselves too on those disparities so that we can keep pushing and keep advocating. I mean, criminal background is one of them too, you know, so like something that we've done, we have created a manager of housing partnership position on our team so that that person can really push. I mean, yes, all of our outreach workers push on reducing that stigma around all of those things and trying to break down the disparity around all of those things. But it's really important to also have a single person that can help build those relationships with people in the community and the landlords, as y'all are talking about, or mental health services and things like that. Because our folks get told no so many times. And so when we can like help advocate for them and bring people like peers in and say, just because they experience a mental illness does not mean they're a bad person, or does not mean they're going to like wreck your apartment, or does not mean that they're going to be aggressive in your waiting room, right? So like we really have to be on top of that and advocate really hard so that we can provide support with them, for them.
Yeah, I was going to add, you know, the importance of the peer, the person with the lived experience is, you know, you can have your policy person with all the data and they can present that to the right people. And those people making that decision think, well, we should do this. But then you bring that powerful story with that demonstration of what that opportunity can allow people to accomplish, then that compels those folks to act on what they think they should do. You know, so that combination, it's that 1-2 punch, and it's very powerful. You know, we can't underestimate that. And you know, and that's also in the peer, that person who has that lived experience that's changed their life. So much of what drives that addiction, that isolation, is that lack of community. And that also reinforces their ties to their community, helping them understand, like, man, you have a powerful voice here. And by you showing up today, sharing your story, you've helped countless people behind you. You know, so that, yeah, so yeah, you guys are doing great things.
Hey, Stephen, I just want to, Stephen, I'm sorry, brother. I just wanted to chime in because there's some hot stuff in the chat box, right? I can't let it go, where we got to make sure when we start to talk about peers and peers working in organizations that they're properly trained. See, and that's the problem. People hire people, right? And one of us, those that are great at what we do, there's one thing, they will hire you and fire you for the same reasons. Understand that, right? Your lived experience can get you hired and your lived experience can get you fired. But the one thing with proper training, right? Just because a person identifies as a person that has struggled with mental health challenges or in recovery, without training them properly to how to use their story. I see Karen mentioned about using the story, right, in a competition form, like I had it worse than you. But see, we have been properly trained, right, that I use this story as a tool. And sometimes I know people 20 years who have never heard the story. And then I've used it where people needed to hear it. So understanding that if your peers are sharing unnecessarily, then they're not properly trained, and you need to call somebody in to teach them how to use their story effectively, because every situation is not in a meeting. Every time it's not, hey, my name is Daryl and I'm an addict. No, it's how do you use this story effectively, whether it's with legislators or with people that are impacted that need to hear that. We need to make sure that our peers are properly trained. Don't say you got peers and you're not training them. That's your fault. That's an organizational issue. That's not an individual issue. Come on, man.
Beautiful stated. Beautifully stated. I mean, it is so frustrating to see that the onus is on the peer to understand what the organization is doing and what they want that peer to be doing, rather than the organization understanding the role of a peer and then tasking them appropriately. And you only get there Daryl, you are spot on. You must train those peers to do the work that they're doing. And there's plenty of that training out there. There is plenty of, the basic peer training, and there's all kinds of other trainings available to learn how to effectively tell your story, how to advocate, big A, little, there's all kinds of that stuff out there for those of us who have that peer background. But what's super important, and I think providers miss this often, is that the organization needs to be oriented, and they need to be oriented thoroughly to what a peer is, what the role is, the difference between a peer and a clinician, why that matters, and what the complementary relationship should be between peers and clinicians. So having said all that, Daryl, I'm going to come back to you really quick. What is your top priority that everybody needs to hear, brother? And I think I probably have heard it from you already, but let's hear it again.
Well, for me, man, if we're talking about impacting people in the justice system, especially brothers and sisters coming home, please, I cannot say it any clearer. Reentry has to begin at the beginning of the sentence. When they enter the system, we need to know what those challenges are. What got you here? How'd you get here? What happened to you? Stop asking people what's wrong with you. Start asking the question, what happened to you? Because many people have said to me all my life, what's wrong with you? And then it makes it look like it's me. But when I start to tell you about the trauma and all the things that I experienced before I entered the correctional system, then you'd understand how I got here. Now I need the experts or some people with some lived experience to help me get back on track so I don't fall into that trap again. So I think the number one thing that definitely is engaging individuals upon entry, as well as, we can't say this enough. I think that, I didn't even realize we was going to take it to the peer place. But if we're not matching people up with people with lived experience, we are doing them a disservice, right? We can't, and you know what? It's going to come to a time, and I'm going to say this here. Can I say this here? That those of us peers, like Ashley, Michael, Stephen, all of us, we're building tables that eventually you're not going to keep getting funding without proper training within your organization. We're going to start calling your organizations out because what you're doing a disservice to the individuals receiving service, and you're doing a disservice to the people that you're hiring because you're not properly training them and then sending them out to try to engage others. Come on, man. That's a disservice, and that's going to stop. Let's go, man.
So you see why I have Daryl McGraw on this event today, and why I have Michael Sanchez and Ashley Blum, because they know, they're here, they've done it, they're in it. And you know what? We're in it to win it, really. And you can see that because we've been doing Recovery Live now for almost 10 years. We ain't going away, and peers aren't going away. And in fact, what you're really seeing is a massive expansion of what peer roles have been. And that's going to continue because there is value here. So let me step back for just a second. I had a bunch of questions and a lot of comments in that chat. And it's for everybody who's been just jamming in the chat. First, thank you for doing that. Second, I apologize. I can't get in there and do as much as I want to because I'm kind of focused on this part of what I'm doing. But it's really, for me, it's just really important to see folks communicating in that chat because it is about the relationship. The relationships matter. And if we're talking to each other, if we're identifying where the challenges are, we are stronger together in advocacy. And much of what we do is advocating for change, for a better way to come at it, for whatever it is that the need is. I think we're about the most powerful advocates you're ever going to meet, because for many of us, we had nothing to lose. So today, we may have stuff to lose, but I think we know how to advocate pretty effectively too. So, it balances it out. So this is a couple, I just pulled some questions. I don't have any names because I try not to pull people's names in. But here's something that the first thing I pulled out of the chat. In my role, I have witnessed a large portion of those with mental health diagnosis experience issues with homelessness. And I've witnessed that there's just not a lot of support to support individuals with mental health and homelessness, especially throughout Pennsylvania. What changes are being made in the area of human services that focuses on homelessness among the mentally ill population? Before you guys answer that, I want to just has been a passion for a very long time, and I just got to notice that my internet connection is unstable. So if I disappear, I'll be back. And Daryl will take over if I disappear.
I'm here, bro, and you're good right now, so keep it rocking. Let's
Awesome.
go.
All right. So what I want to say about these changes being made that focuses on homelessness among the mentally ill population is this. I've been advocating since 2007, 2008, that the recovery world needs to join forces with the homeless service delivery world, because my homeless brothers and sisters, I'm exactly the same. I spent time homeless. I've dealt with the same struggles that many of them are dealing with. And most of this has been addressed in my recovery journey. And so why wouldn't we work to bring at least the recovery philosophy to the homeless service world and provide, as Ashley put this earlier, whole person help, whole person support? We have to stop looking at at one issue at a time. The person's homeless, housing. The person has a mental illness, treatment. The person has a drug addiction, rehab. What if the person has all of them? Because most of us do. So if we're missing that piece, the recovery piece, then whoever posed this question, what change is being made in human services, we're going to fail. And the reason I know that we're going to fail if we don't make these changes, we don't use peers, we don't use these folks who have this lived experience, is because this is what we did before peers. And we see where we're at today. And where we're at today, we're starting to climb ourselves out of this gigantic hole on the backs of the peers who have helped us understand where we've gone off the rails. So I really wanted to respond to that, and then I'll stop talking. Ashley, Michael, Daryl, your thoughts.
So I really resonated with a lot of what you said, Steve. I mean, clearly peers are huge. I also think that coordinating care is also huge. So, and when I say that, I just created a whole curriculum for our organization because I think it is so important. And it's not just important inside your own organization, it's important externally too. We need to know who's working with the person so that we can, and stop working in silos. And that's what Nashville has been doing so well recently, is like, we've had everyone at the table. We utilize homeless management information system. We have a shared system where we can enter people's data into our coordinated entry system, and we're able to navigate and know who's working with whom, and then figure out who needs to be, because we need folks in the right seat of the bus. Like, they need to be receiving the right services. So just because I encountered someone, from our SOAR team, so we have a SOAR team, shout out to SOAR, we have a SOAR team. So if we encounter someone on SOAR, but they have other needs that maybe we can't meet, we may work on their SOAR, but we're going to still reach out to folks where they may fit in, better. So we may still work on their SOAR stuff, but if it's someone living with HIV, or we may call our HIV services, or, and to make sure that the people are getting the best care, we need to make sure that we know who's at our table and utilize everyone at the table and not try to do everything ourselves, because that's when the system's going to fail. If the people are not getting the right services for them, then they're going to continue to fall into those cracks. Or if when we're done with SOAR, we say, hey, here's your disability benefits, see you later. Like, that's just not how we work. And that's not how anyone should work. We shouldn't work in silos. We should all be at the same table, so that so our folks aren't falling into cracks. So that's a big, I think, what we've done in Nashville, at least, to answer that question, because it's, we have mental health services at the table, we have homeless services at the table, we have corrections folks at the table, to where we can start the disability right before they get out, not right before they get out, but within 120 days before they get out, so that when they get out, they'll have that benefit. Or they'll start working on housing the minute they walk through the door of a psychiatric hospital, or whatever the case may be. Because you're right, Daryl, they're experiencing homelessness and mental illness before they went in, then they're going to when they get out as well, unless services are wrapped around them. So we just all have to be at the table and utilize systems that allow us to communicate. Because if one piece is not communicating, then that's a gap. And then people may fall into those gaps. So that's what we're doing in Nashville.
Yeah.
Awesomely stated, Ashley. Michael, thoughts?
Yeah, I shared some resources about, some of the alternative court programs in Denver, Colorado. And there's one that I'm particularly fond of. It's Outreach Court, which used to be called Homelessness Court. And it's at the Central Library here in Denver. And one of the great things about that is not only do folks come in and they have to have a warrant, and it has to be misdemeanor, but they usually give them community service, or just say, hey, connect with these folks. And, the community mental health provider organization is there. There are people from human services. We're working on partnering with their forensic peer navigation team. So because that is structured in a way that they can only get up to a certain point of adjudication, but people get that support from their peers. They want to continue with that. So there's some creative things being done with the acknowledgement that the system is not working. And, kind of the beauty and irony of that is that it's funded by the system. But, it's these strange bedfellows, but that's what it takes, step out of our silos, remember who's at the table, get to know who those folks are, and if people are working for larger institutions, I implore you to let people have some autonomy, let people hit the streets, let people make connections where they count, and help establish that trust. Because if you're working with a big institution, there's a chance there where someone has a relationship that's been damaged. I mean, we have to remember that Medicaid has only been available since 2014. Prior to that, people who lived in poverty waited till they could not stand symptoms anymore. They went to the hospital, went to the ER, where many of them died. The lesson there is, I'm not going to Denver Health, or I'm not going to whatever city's general hospital, because that's where you go to die. And that may be a myth in the mind of people who have had healthcare their entire lives, who know how to utilize the system effectively. But if you haven't, that is a truth, because that's what your experience has taught you. So we still cannot forget the history of healthcare in this country, of mental health services in this country, and understand that those systems have damaged many lives. And there's a cultural history that we have to be aware of and help people work through, and work hard to earn their trust.
Michael, that is spot on. And I'm just going to add that when the ACA actually was passed and folks had access for the very first time, I went and did a case study with the LA Community Health Project in Los Angeles, California, when all of that was happening. And the reason I'm sharing this is because what you said about how people see going in for some sort of physical health treatment has been, for most folks experiencing homelessness, a horrible experience, a very stigmatizing experience with a lot of provider bias. What are you doing in my ER? That, the Gomer, get out of my ER kind of thing. Those things are real. And that kind of stigma is powerful. And it's so powerful that the majority of people who received their actual health insurance when the ACA was actually done and approved and moved forward, those folks, the vast majority of them did their first doctor visit and swore they'd never come back. And they ended up going to an FQHC, a federally qualified health center that had been working with people with HIV, because those folks came at it person-centered, trauma-informed, whole person care. And when they did that and they set up their waiting room to accommodate IV drug users while they waited to be seen by a nurse in order to go through the intake, if you started to get sick, you had a place where you could go and use. I mean, that's the level that, honest to God, we need. We need that because of what you just said, Michael. We have been seriously harmed at times. And we have very little trust in the system that for a very long time threw us in jail, talked down to us, stigmatized us, made us believe that we were terrible, horrible human beings. They did a lot of damage to us. And now here we are with them asking us to come back. Okay, we'll entertain that. But to do that, for us to come back, we need to see people like us. If we don't see people like us, we're not coming. And we've already shown that. So let me check in. Daryl, did you have anything else you wanted to add before I go to the next question?
I just wanted to, I really appreciate the conversation, and we're moving, man. This is a lot, man. This chat box is on fire. We're not going to be able to hit all of them. That's a whole nother talk of stuff I see in here. I would be remiss not to talk about how COVID has affected and created more homeless people than ever, right? So now people who have normally not been homeless are now homeless, right? We're adding to those roles. And then those people that who are used to utilizing the system are told to wait a little bit longer, as if they haven't been waiting long enough. So here we are talking about all these systems. And I love when Ashley talked about the silos, right? Because, we got the housing system that are just housing people. They don't care about their addiction issues. They don't care about their mental health issues. They just care about getting them housed. They'll be out 60 days. You may be evicted 60 days later, but they can check that box. We housed 500 people, and 60 days later, 500 people needed housing again. We know we ain't gonna call nobody out right now, but we know those systems exist, right? Instead of us working together and making sure that they are prepared for housing before you house them. And let's stop playing this shell game with people's lives while you go back home to your nice warm house. Come on, man. We're gonna start calling this truth be told. You know what I mean?
And it's the truth. That's why we continue working with people, because till the very end, because
That's right.
we do not want, yes, we're not going to call people out, but I'm saying we have to keep working with people, and we have to have outreach teams that are passionate and to follow them all the way through. It took us 3 years to house one person, and we didn't care. Because, we calculated it was like 285 hours we spent on working with that person. And these are like, sometimes 15-minute encounters. But we did not care because we cared about the person, and we cared about watching that person end up in his own home with his own keys and with the support wrapped around him so that he didn't go back. 25 years out there, that's all he knew. And he needed us a little bit more than maybe some other people needed us. So we gave that to him. And that's what's so important. So thanks for saying
Ashley, that was, it's so important. And I want to throw this question out because it's connected directly to these two comments. Our outreach teams are struggling to make successful connections to mainstream providers, mental health, primary care, SUD treatment. Given ongoing barriers associated with the pandemic, low staffing, no minimal or minimal face-to-face, Any recommendations on how to improve handoffs so the street outreach teams can focus on identifying and working with other folks who are unsheltered? How do we strengthen those relationships with providers who do not specifically work with individuals experiencing homelessness? That is a freaking $1 million question, really. Thoughts, guys?
You know, my approach is be a bit assertive. You know, walk with your client recovery into that building, introduce yourself, let them know what your role is, why you're there, and oftentimes you'll find you are just the person they've been waiting for to walk through that door and make their lives easier. You know, we look at the system in dichotomous ways, but, you know, we have a lot of friends on the inside. You know, there's a lot of passionate people working for big institutions, working for the people that we see as, or institutions that we see as barriers. But trust me, we have friends on every side of every wall that we face, you know, so it's incumbent on us to be advocates for the folks we're helping, as well as ourselves, our agencies, the peer workforce, whatever role we're in, you know. And like I said, oftentimes they've been waiting for us. They just didn't know where to go out and get us. So we have to come to them.
I think that if you're not a homeless outreach provider, go find the homeless outreach providers in your area. Get to know them. If you are a homeless outreach provider, start doing in-reach. So like what we do is, like, we went into our behavioral care center yesterday. We have a new diversion program. So when someone's arrested, they can choose to go a route to go into like a 30-day mental health substance use program per se, instead of getting arrested. This is a great path for some people. And so we go in and we tell them about our programs, and we meet them and we get to know them, the staff, okay? And so it's same with, like, you know, hospitals. And so if you're a homeless outreach provider on this call, go sell yourself. Go tell people go tell people how they can get someone connected. Because what's happening is that people are going into ER or going into jail and going in, and they don't know that we exist. These, like, the people don't know we exist, and the staff at the facilities don't know we exist. So if you let yourselves be known, and then if you're not a homeless outreach program, go find the folks so that you can be known, so that you can know who to make those connections to. I talk to doctors all the time at Vanderbilt. Like, actually, I'm actually making a presentation this afternoon, right after this, to Vanderbilt residents and to doctors, because they need to know about us. They need to know how to make that connection. And we can come and meet them when they're at one of their oncology appointments. Like, I did that, where there's this oncologist who called me, and because I have lived experience with cancer, and so I know a lot of doctors at Vanderbilt for you know, now oncology. And she called me and she said, "I know what you do. Can you please come talk to this person? He's been living in his car." And I was able to come over and, like, in my, like, work capacity and meet with the person, because she knew what I did. And so I was able to wrap resources around him, get him his disability so that he could continue his care and continue his life, you know? So it's just those things, I think, can really help build those bridges, so that we can, it goes back to that care coordination, you know? I think it's just, you've got to bridge gaps. And if you're not a homeless provider, find them, you know, find them in your city. If you don't have them, push up and say, we need this, because that's how you're going to get, like, all of their needs met, because those nurses and those doctors cannot, you know, go out into the streets and work with people. So they need the folks that are going to be able to go out and find people. No, we have 3 minutes left.
Ashley?
I'll stop talking.
No, that was fantastic. I mean, it's accurate, right? I mean, it's pretty much what everybody has said here. You know, it's the relationship that matters. It's, you know, Michael sharing. It's all about love. It is. I mean, it really is. It's about given a shit. Excuse my language, but it's about caring. And it's about caring for people who might not look like you, or might not smell like you, or might not have the same color skin as you. I don't give a crap about any of those pieces. What matters to me is, where's this brother or sister going to lay their head tonight? And when they lay it there, are they going to be able to do a full night's sleep safely? Or will they be rolled into the Cumberland River? Or will they be arrested? Or will they be beaten? Because all of those things have happened to my brothers and sisters right here in downtown Nashville. All of them. And they happen everywhere around the country every day. So, folks, I apologize. I can't get to all the questions. This chat has been amazing. Daryl and Michael and Ashley, gang, thank you for showing up and just, kind of coming and putting the time in. I guess what I want to say about the chat is, you guys, that was freaking awesome. And this is exactly what Recovery Live is for. It is to have all of us talking together, sharing information, sharing those resources, and knowing you're not alone, and that we understand the challenges that you're all facing. We're facing them too. And all of us together will make the changes. We are. We have been, we are. That's why we're here. So, Michael, Ashley, and Daryl, thank you guys. For everybody else that's here, make sure you come back next month. We'll be here. There's going to be a satisfaction survey that pops up as soon as we close this event. Please take the time to fill it out. Take you 2 minutes, and we pay attention. That's why Recovery Live is the way it is. We've listened to all of you. So thank you guys. Have a lovely afternoon, and we'll see you next month at Recovery Live.